Okay, let's start ultrasonography in ophthalmology. Okay, so we are going very slowly because there are a lot of things to cover in ultrasonography in ophthalmology. So this is just part one. Okay, so introduction. So sound has been used clinically as an alternative to light in the diagnostic evaluation of variety of conditions. So basically means alternative to light, which means when light cannot pass, the sound will be passed. So advantage sound over the light, it can pass through the opaque tissue. An important tool in terms of diagnosis and management, isn't it? So it's a in non-invasive investigation of a choice of study in opaque media. So suppose someone has dense cataract and you want to know what's the status of the retina. At least you can see the shape of the retina. So shape of that curve, which is that okay, or is there any retinal detachment or something? So that's very important, isn't it? So we routinely do in case of that. So the definition is ultrasound means basically ultrasound waves and are the acoustic wave. I think you know acoustic wave, isn't it? It's a mechanical wave, basically needs some media to transfer, and that have frequency of greater than 20 kilohertz. And as a human we can response to the audible frequency range from 20 hertz to 20 kilohertz. So above the 20 kilohertz we can say ultrasound. This is same like the light, so something like this acoustic sound, and it's ultrasound more than frequency. What do you say? The light, the suppose example red, then the violent, then ultraviolet. The frequency of ultraviolet greater than ultraviolet is greater than violent is ultraviolet. Frequency below than red is infrared, isn't it? That's why see, below 20 is infrasound, above 20 kilohertz is ultrasound. So just remember this term, okay? So advantages of USC. What are the advantages of USC? So first, it's easy to use, non-ionizing radiations, definitely excellent tissue differentiation. Uh, we can do from the USC, and cost effectiveness. Primary uses in ophthalmology. Where do we use ultrasonography? Posterior segment evaluation on hazy media and definitely on orbit 2. The structural integrity of eye, but not a functional integrity. That's a very important differentiation. Okay, so so basically structural integrity, not a functional, because USC will not tell you the what's function of optic nerve or how optic nerve is functioning, isn't it? And another thought is detection and differentiation of intraocular and orbital lesion. So it's very important whether it is ocular lesion or the orbital lesion. So basically USC will tell us. And tissue thickness and measurement, isn't it? Sometimes we can even measure from a scan, we can measure the thickness of basically what do you call it, extraocular muscles too. The location of intraocular foreign body, isn't it? It's very useful. Ocular biometry. A scan is very much used in ocular biometry, especially in case of those cases where the media is opaque, which cataracts is dense. Then we didn't have opportunity to measure the axial length from basically light. Basically, what do you call that? Infrared techniques. So physics, it's very simple physics. Ultrasound are acoustic wave, mechanical wave that consist of an oscillation of particles that vibrates in the direction of propagation. See in this animation, isn't it? It's like normally oscillate particle characterized in velocity. So which is basically longitudinal wave, isn't it? It's not an altitudinal. It's not a wave with wave like light. So consists of alternating compression and refraction with the molecular media and oscillating particles, the characteristics by the velocity, isn't it? So velocity, what is velocity, isn't it? Wavelength in into frequencies, velocity. We are very much simply know that the depends upon the density of the media. As the media has become denser, the velocity of acoustic wave goes higher. So it's very simple, isn't it? Take 33 microseconds to come back from the posterior pole to the transduction. Oh, okay, fine. And about 1500 meter per second average velocity in a phakic eye, and in 1532 meter per second rough in aphakic eye. So this is there is a chance this is numbers come in your MCQs. It's very important. Sometimes asked, okay, in MCQs. Just remember these terms, okay? So sound wave velocities through different media. Just it's for rough guideline. Water, this number echoes 1532, silicon oil, slower and crystalline lens 1641 PMMA, much higher. Silicon oil, I think silicon lens and silicon oil is much slower. Tissues, roughly bones, higher. As the density increase, speed definitely increase. We know it. Just so now this is very important concept here. Okay, frequency. Frequency means what are the frequencies we use? You normally generally we use 6 to 20 megahertz, but roughly around 8 to 12 megahertz is very common in ultrasonography. High frequency provides better resolution. I'll tell you about it. So 8 megahertz in A scan typically and 10 megahertz in B scan, and we'll definitely going to talk about what A scan is, what B scan is. Okay, and right now it's completely okay. So low frequency 1 to 2 megahertz is used in scanning, giving the better penetration. So means normally it's used in abdominal USC. So USC used by USC, basically abdominal USC. So basically using USC used in abdomen and even pelvis area. So 1 to 2 megahertz. So why ophthalmology use such a high megahertz, and why abdominal USC radiologists use such a low USC? It's basically the conundrum, the balance between depth and the resolution. See, this is very important. If you use lower frequency, it will give larger depth, but at the same time there is consequences. It will give low resolution. Okay, I'll show you in I think second part of the USC the pictures too. So basically means lower frequency has a benefit of long depth. Lower frequency you use, it penetrates to the long depth, but at the same time resolution is limited. At the same time, when you use high frequency, its depth is very slow, but its resolution is very high. So why ophthalmology we use high frequency? Because in eye is like 24 mm, we don't need that depth in eye, but we need very high resolution. Why? Because retina is so tiny, so small layer, isn't it? Choroid is so small layer. Vitreous itself 16 mm, but that 16 mm is very less in compared to abdomen itself. Can you imagine it? So that's very important point. I'll again go again, and we can again think about another point like wavelength. So wavelength, what do you mean by longer the wavelength, greater the penetration, isn't it? The shorter the wavelength means greater the frequency, shorter the penetration. But at the same time, longer the wavelength, resolution is less. Shorter the wavelength, resolution is high. So that's why good resolution in minute structure like ocular structure and orbital structure is very important, that we use high frequency. But just contrast, always contrast with abdominal USC. Why they use, radiologists use 1 to 2 megahertz? Because abdomen is a large structure. You need depth to penetrate. But I think resolution is important, but not that much as in eye. Eye, you need resolution sharp. So that's why higher the frequency, better the resolution. At the same time, cost of depth of penetration. Okay, fine. So let me show you in this. This slide. I have this is very good slide. Okay, so there is parameter low frequency and high frequency. So low frequency means 2 to 5 megahertz. High frequency means in US ophthalmology it's about 10 megahertz. Okay, so wavelength, low frequency means long wavelength, high frequency means short wavelength. Penetration, if there is low frequency, greater the penetration, but at the same time shallower the penetration, limited. Resolution, just opposite, greater the penetration, lower the resolution. At the same time, higher frequency, higher the resolution. Best for deep organs like abdominal, pelvis, or obstetrics, gynecology. So there is use of low frequencies ultrasound, but at the same time most superficial structure like thyroid, breast vessels, musculoskeletal, especially in ophthalmology USC, it needs high frequency USC. And when we use the higher frequency, it's like USC for choroid, isn't it? USC microscopy. So So reflectivity. Now we move to some few important terms. So what is reflectivity? The sound travel from one media to another media to different density. The part of the sound back into the probe is called reflectivity. So it is known as echo, isn't it? You have all heard about echo. Your own echo, isn't it? The greater the density difference at the interference, stronger the echo and higher the reflectivity. Basically means if this is I and greater the difference between reflectivity between aqueous and the lens, higher the reflectivity from the lens. From a lens to vitreous, higher the reflectivity from the lens and vitreous junction, isn't it? So greater the density difference in the interference between vitreous and the retina and the choroid and the orbital fat, isn't it? So basically, the difference is greater, the stronger the echo and higher the reflectivity. It's very important. So A scan USC echoes represented by the spikes rises from the baseline. Basically means if spike rises higher, see this area. So higher the spike rise, basically means higher the reflectivity. So stronger the echo, higher the spikes. The B scan, what do you mean by higher the echo? Echoes which represents as a multitude of dots together and from the image scan. So stronger the echo, brighter the dot because B scan means it's two dimensional. One reflectivity shows in a brightness, okay, isn't it? I'll tell you about it. So what do you mean by absorption? Ultrasound is not just reflected, it absorbed too, is absorbed by the medium through which it passes. Because see, if it should pass through the if I close, then it should pass through the lid, and if I open it, then it should pass through the lens, cornea, and every media will absorb the sound, isn't it? It's very simple concept. The more the dense medium, the greater the amount of absorption. Means the more denser cataract, more amount of light is absorbed, isn't it? The density of the solid lead structure results in absorption of path of sound when B scan is performed throughout the closed eye. If we close and perform B scan, definitely lead will going to absorb, thereby compromising the image of the posterior segment. It's very important because much of the sound is absorbed by the lead. Then it won't reach to retina in that amount which if lid is open through the sclera we send the sound. So that's why this is the point. B scans should be performed on open eye unless the patient is small child or has open wound. Yes, if someone has opened in, I think ultrasonography is contraindicated, but still in child and if patient is not cooperative, that's completely okay. But if patient is cooperative and if you may take all the measurements safety and like infection safety and all everything, then it's better to perform through sclera than through lead because lead will absorb the sound wave. When performing USC through the dense cataract, more of the sound is absorbed by the dense cataractous lens. Because if lens is less cataract, like lens is not at all cataract, then the problem is less. The if lens is more and more cataractous, then you have to increase your gain of the machine because it will absorb denser the cataract, more sound will absorb there. So less is able to pass through the next medium and resulting in weaker echoes and image on the A scan and B scan basically. So the best image of the posterior segment are obtained when probe is contact with the sclera. That's what I'm talking about, rather than the corneal surface bypassing crystalline lens. It basically means, let me draw you. Don't throw suppose probe here directly here. If cataractus, this media is cataract, just throw the probe from here, sound from here, because from sclera, because if you throw sound from here you will avoid the lens, isn't it? So basically bypassing crystalline lens or IL impact, and then your sound move from there and you will see this retina clearly. So sometimes it's very tricky that you sometimes try to avoid the lens because it's cataractus and you pass from another part like sclera and don't touching bypassing crystalline lens, which is very useful to understand this concept. So echo location is commonly used by definitely by sharks, by bat as we know, and from pandus. What do you call pandus? Yes, sea. I don't know. I think pandus. Whatever the fight tank ships. So ecos. So ultrasound echo, ultrasound reflection and the refraction both happens, isn't it? So basically means when we send the sound, many of the sound refract and move here, and sound reflect and come back to basically that sensor, that piezoelectric sensor. So echo reflect proportion of wave which is produce acoustic interference. So creating the injunction between two media have different acoustic impedance. The different sound velocity and the density. Acoustic impedance basically depends upon sound velocity in the density. So basically means how sound passes, there is an impedance in that, and the higher the difference between the media, in higher the refractive index difference, higher the density difference, the higher the sound reflect from it, because the sound passing of sound impedance is higher. So that's why in first picture medium 1 less sound reflect, but in second picture medium 2 larger sound reflect. And as compared to first picture, this picture less amount of light passes, refract from it. That's the basic concept. Okay? So basically means, what is the medium 1 and this is medium 2. So basically when you send the sound, a bit of sound echoed and a bit of sound refract, transmit, isn't it? And what makes that sound echoed and what makes that sound transmitted depend upon the boundary, isn't it? So factor influence the returning echo are, so basically, one is boundary interference, another is angle of sound beam, another is size and shape of the interference. Why this is important? Because this is important how you put the sound in your patient's eye, the angle. Second, you must know the concept about interference, the boundary. Third, if you want to see something, suppose example of vitreous hemorrhage, new vitreous hemorrhage and old vitreous hemorrhage, what is the difference? If you want to know the difference between vitreous hemorrhage and the crystalline body, isn't it? So that's the difference. And if there is a difference, then which structure will definitely reflect more light? And depending on that, A scan spikes and B scan dot brightness depends. And that's how you diagnose that yes, there is something which is more denser, there is something which is less denser, isn't it? So you have to understand what are the factors that influence the returning echoes. It's very important. So let's move forward. So angle of incidence is very simple. See in this picture A, B and C. Can you see? The more angular you send the signal, the less amplitude you have. Basically mean the angle of incidence which sound encounters in the ocular structure. Sound beam direct perpendicular to the structure shows the maximum amount. See, if sound beam is perpendicular in this A picture, the maximum the sound reflected from the farther away from the ideal point, lower the amplitude. So that's what I'm talking about. Picture A, B, C. Can you see? Picture A, maximum reflectance. Picture B, less. Picture C, least. Isn't it? Okay, let's move forward. So interface, what do you mean by interface? Interface means by relative difference between various tissues that the sound beam encounter. Basically means strong and weak echoes due to the significant tissue difference. Remember at this point. For example, the difference in interference between vitreous and freshly blood is slightly, resulting in small echo. That's what I'm talking about. The fresh blood and the vitreous difference is basically very low, but the difference between detached retina and the vitreous is very high. That's why large spike in this case, isn't it? Vitreous and the detached retina, but the spikes in case of fresh blood in vitreous is very less. So you have to know the interface, which are the interference. Okay, so texture and the shape of the interference is very important. See, this picture is very clear. Basically means interference means how much light, how much sound is coming back. So smooth surface like retina will give strong reflection, remember this. Smooth and round surface with scattered beam and the reflection of sound is a bit, little bit less. But come to this point, coarse surface like this, not regular, irregular, like ciliary body or membrane in the folds tend to scatter beam without any single strong reflection. It's very less reflection, such a scattered, such a coarse surface. And finally, a small interface that is scattering light, scattering of the reflection. Basically, see in this picture, the round, strong structure, reflection in everywhere. So very few sound wave back to the probe. That's why spikes is less, and in B scan brightness is less. So basically, this is it for today for introduction. In second presentation, second part, I will definitely show you some pictures. And just remember, these are the great book. I don't want to say this book is better than this. Just pick any of the book, and all are great. Okay, so I think that's it. So Bistan, choose.